Yes, sir. We are live now. Going live almost.
Okay.
We'll just start in a minute because we have kept the YouTube stream at 1 minute delay because there is a quiz today. Hello, everyone. Good evening and a very warm welcome to National Pathology Day 2022 event organized by IAPM in association with the Karnataka Chapter. I'm Dr. Aditya Agnihotri, Assistant Professor at SGM College of Medical Sciences and Hospital, Dharwad. I'm also the Secretary of KCIAPM and I'll be coordinating this event. Before we begin, at the outset, I would like to welcome Dr. Kim Wi-Fi, President IAPM, Dr. Asrantekar, Secretary IAPM, Dr. Past President, Immediate Past President, Dr. Vatsala Mishra, and Past President and Executive Committee members of IAPM, Dr. and IJPM committee members, Dr. Anjana Agarwal, Dr. Vijay Shankar, Dr. Bharat Rekhi, Dr. Saranya, and President of Karnataka Chapter of IAPM, Dr. N.K. Alva. We also have very senior pathologists like Dr. Ranjan sir, Dr. Datta Gupta sir here joining us for this event. Before we get started, this National Pathology Day is a very special day for all of us today because across the country, all pathologists have come together to celebrate this special occasion to observe the birth anniversary of Dr. V.R. Khanolkar, who has made immense contributions to the field of pathology and is also the founder of IAPM. To tell us more about the National Pathology Day, I now welcome Dr. Kim Wi-Fi, President IAPM, to say a few words. Ma'am, over to you.
Yeah. I have few slides, Aditya, 4 or 5 slides. Can I share them?
Yes, ma'am.
Okay.
Please go ahead.
Something is coming on here.
Just tap on the share button, ma'am, and open the PowerPoint.
Yeah, I know something is open up. Weather forecast is opening up. It's not coming. Something else is coming. Microsoft. Okay, it's come here. Thank you, Dr. Aditya, formally. And it is a big day for all of us. And I think I'm very fortunate to be associated with this, the first National Pathology Day, organizing this particular event with Karnataka Chapter. And I think the initiative had come from Karnataka Chapter. I'm really very grateful for their initiative. And everything has been done by Karnataka Chapter. And this National Pathology Day, possibly there has been, though this is the first time that we are going to celebrate in our country, but I think there is something called International Pathology Day, which I was logging in today on the, online, and I could see that that has been going on for the last 8 years, and that is organized by the by the British Association. And so I do not know how actually, otherwise they have around 11,000 members. I'm totally unaware of it. And I have to look into it, work into it more in detail, because today there was no time for me to work into this. And we also should try and collaborate with them, try to be a part of that organization, which is the international. Definitely, we are going to have our own day, but their International Pathology Day, possibly it is towards the end of November or beginning of December every year. And so I think R is going to be fixed on 13 April. And I do have few photographs of those. This is the International Pathology Day history. They have fixed the dates, but in 2021, they had it in the first week of December. And so they say that there are 11 members worldwide. These are from the Royal College of Pathologists, but majority of them are located in UK itself. And this time, last time in December, their main topic was artificial intelligence. I think most of the talk had been conducted on artificial intelligence. They have chosen that particular topic. But for us, this is the first time. So I think besides the quiz, which is we are holding it for the postgraduate, the rest are very formal talks. We have not really chosen any particular topic. But in the future, with the help of the executive committee members and the GBM, I think one can fix up one particular topic every year and take it up at national level, and which would be helpful for the postgraduates and also for the practicing pathologists, so that we can improve our standard and level of day-to-day pathology practice. And this is the person who had organized. He is the president of the person who had organized. And then I think there was also, they had a talk on Lancet Commission on Diagnostics. And this is a kind of trying to, I think here the second point I think is very important. Only 1% of primary care clinics have basic diagnostic capacity. This is WHO data. I think this is very important, and so we should be aware of this. I think in our country also possibly the same story, or maybe in our country would be less than 1%. And so these are some of the points which we all can look into it. So these can be taken forward on maybe 10 years time. We may plan for 10 years that we should achieve this in 5 years, whatever it is, that kind of a thing which one can plan. And so this is a kind of the people who had taken part in that particular gathering in 2021. And so this is my suggestion that we should not stop just celebrating in our country itself. We should try and have more interactions at the international level, so that we also get exposed to what the other people are doing. Thank you very much for your kind attention. Thank you, Aditya.
Okay, thank you, ma'am, for that brief introduction. I now let's begin with the talks for the day. I now welcome Dr. Nandakishore Alva, sir, President KCA Karnataka Chapter-IAPM, to introduce our faculty for the first talk, and that is Dr. Sanjay Pai.
Dr. Aditya. Well, at the outset, I would like to extend a very wishes to all of you on behalf of National Pathology Day. First ever is being celebrated in our country, and I'm happy that KCIAPM is also hosting this National Pathology Day on this particular birthday of our great pathologist, Professor Khanolkar. Well, I would like to take this opportunity also to welcome all of you to IAPM meet, which we are going to have in this year end, that is APCON 2022. At the outset, I would like to thank each and everyone who has bestowed this opportunity to us to host this conference at Ramaya Medical College. Well, today we have Dr. Sanjay Pai with us, who is going to talk about Professor V.R. Khanolkar, pioneering Indian pathologist. And I'm glad to introduce Dr. Sanjay Pai, though he doesn't need one. Dr. Pai is graduated from Grant Medical College and MD from Tata Memorial Hospital, Mumbai. And he currently heads Department of Laboratory Medicine at Manipal Hospital, Yashwantpur in Bangalore. Very eminent pathologist and eminent academician too. He is on editorial board of National Medical Journal of India and former editor of Indian Journal of Cancer. Dr. Pai has over 200 publications to his credit, national and international journals indexed, and has contributed to a chapter in new WHO classification on head and neck tumors. Dr. Sanjay Pai is a very good friend of mine, and his keen interest is in medical ethics as well as in the history of medicine. So I think he is the right person to talk about Professor Khanolkar in the perspective of a pioneering Indian pathologist. Thank you, Dr. Sanjay Pai, for accepting this, our invitation to talk about Professor Khanolkar. Over to Dr. Pai.
Thank you very much, guys, for inviting me today for this inaugural talk of the inaugural meeting of the National Pathology Day. Let me begin by showing you guys my PowerPoint. Okay, now how do I get rid of this? Okay. Can you guys see my screen? We are Khanolkar.
Please go ahead.
Excellent, fine. So, okay, just before I start, Dr. Wi-Fi had referred to the Lancet Commission on Diagnostics. I was a Lancet commissioner actually. They said 25 pathologists from 16 countries. I was the one from India, but that's not relevant out here.
Hey, that's great. Ah,
So maybe we can have some ideas later together for the
yes,
National
yes.
Pathology Day.
Yeah.
But anyway, let's begin off with Khanolkar, and I'm glad that I was asked to talk on a topic of, well, of my interest, so to say. And here's a photograph of Khanolkar in his late 70s. And here's the one which has been distributed to you guys on all the platforms. And if you look at this book out here, you can see the word OGY at the very corner on the spine. So obviously he's holding a book of pathology. Now the background biographical bump to Vasant Ramji Khanolkar is that he was born in Quetta in Balochistan on, well, obviously April 13, 1895. He joined Grant Medical College in 1912. That's 70 years before I joined Grant Medical College. But unlike me, there are no further details available about Khanolkar's life and times in Grant Medical College. I've tried a lot over the years, but I've been able to get no information whatsoever. We do know, however, that he then moved over to London, where he did his MD in pathology at the University of London around 1922. He was the first student to pass in 2 years, and it also meant that he was the first Indian ever to pass an MD in pathology. And here is a photograph of Khanolkar around the time he was a Graham Research Scholar. I got this yesterday on the website of ACTREC, and I'll come to ACTREC later. I have the permission of the director of ACTREC to use these photographs. And I must say, I prefer black and white to color, so I think these photographs are absolutely lovely. When he was a Graham Research Scholar, he published this paper, Non-Specific Training of Antibody Production. This, if you can see what's on top, is it's an off-print. And that's a word which many youngsters will probably not know today. It's an off-print from the Journal of Pathology and Bacteriology from 1924. I suspect this is one of the very few off-prints in existence, and I am the proud owner of this off-print. It's 98 years old. I'm scared to touch it because I'm scared it will fall to pieces when I touch it. And you can see from this photograph how old it is, the yellowed pages. Subsequent to his Graham Research Scholarship, he came back to India, and I don't remember where I got a copy of this letter, but this is a letter which says, I'm directed to inform you that the commissioner has sanctioned the appointment of Dr. V.R. Khanolkar as Professor of Pathology at the Grant Medical College, Bombay. This is in January 1924 when Khanolkar is less than 29 years old. But that's because he was the first MD in India. He was to get a salary of 700 rupees per month for the first year, and 750 per month for the second year, plus a special pay of rupees 300 per month. A lot of money in those days. So Khanolkar was professor of pathology at Grant Medical in Bombay in 1924 to 1926. We have very little information about what work he did then. Dr. Lanjewar and Amita Joshi and I are trying to work out data on what Khanolkar did in those years. And we do know that he performed about 20 autopsies in the 2 years that he was at Grant Medical. We have no information on what else he did. I mean, okay, here's another picture of this very nattily dressed chappie, as you can see. Even in the earlier photographs, you see that he's very, very well dressed and man about town. You can see, in fact, his watch in his pocket. So in 1926, Seth GS Medical College and KEM Hospital was established, and this was supposed to be headed by Indians for Indians. And that's when Khanolkar left Grant Medical, which was essentially created by the British and had a lot of British professors. So he joined KEM Hospital because he was a patriot. From 1926 to 1940, he was at KEM Hospital, where we know that apart from being a pathologist, he was an acting dean from 1931 to 1933. We know that he started a medical artists unit out there, and he was responsible, well, like all pathologists, for the creation of the museum. We know very, very little about what else he did out there. And again, Amita Joshi of KEM and Dr. Lanjewar and I are trying to work out something. But this is the one thing that we do know. And Dr. Amita Joshi unearthed this wonderful piece of information. She got out this autopsy register of 1935, and it appears that Khanolkar performed one autopsy in 1935, and this is the only one. And what is interesting is if you look very, very closely at the name of the patient or the body, it's a Mrs. Khanolkar. So I suspect it was either a relative of his or he was curious enough to do the autopsy because the name was similar to his. But we have absolutely no other information about what he did in KEM from 1926 to 1940. We just don't have the records. However, in 1941, he moved over just next door to Tata Memorial Hospital. Again, it appears that he was not very keen to join Tata Hospital, but he was told that if he didn't join it, they'd get a Britisher to head this hospital, to head the Department of Pathology at this hospital. And that was something Khanolkar could not accept. And so he moved over to Tata only because he wanted an Indian to be the first head of pathology at this, our prestigious cancer hospital. And from 1941 to 52, he was head of pathology at Tata Memorial, and that's when he published some fantastic papers. After that, in 1952, we created what was then called the Indian Cancer Research, I've written research twice, Indian Cancer Research Institute, or ICRC. This was later renamed the Cancer Research Institute, or the CRI, and it has now been called the ACTREC, or Advanced Center for Treatment and Research and Education in Cancer. The ICRC and CRI were, of course, in Parel, next to the Tata Memorial Hospital, but ACTREC has moved to New Bombay. In 1963, when he was 68 years old, Khanolkar was appointed National Research Professor. There are at any given time only 10 National Research Professors in India across subjects, not just medicine. And this is, now there are many, many great papers that he has written. I've selected only a couple of them to show you the variety of stuff that he published. And this is a paper from Archives of Pathology in November, December 1945. And he calls this Cancer in Relation to Usages. 3 new types in India, and this is by Khanolkar and Suryabai. And in this, he talks about kidney cancer when he talks about cancer being formed in the oral cavity due to keeping of tobacco and slake lime near the lip. He also talks about what all of us know, dhoti or sari cancer, where a sari or a dhoti is tied so tight that due to friction between the cloth and the skin, it leads to a squamous carcinoma of the skin. And the third cancer that he spoke about was something which was peculiar to Andhra Pradesh, which is where Suryabai came from. And this is about reverse smoking, where the practice is to use the lit end of the bidi and to keep it inside the mouth. And that leads to higher an increase of temperature in the oral cavity and leads to oral cancer. So an unusual thing, because this was published in an American journal, he has actually described how a dhoti is to be worn, because obviously no American is going to know what a dhoti is or how it is to be worn. So this has also been described in great detail. And then he explains about how it can be seen from these descriptions that the dhoti exerts pressure in the loins and the groin and so on, and ultimately leads to squamous carcinoma. Another wonderful paper, and one of his most important papers, is this: Smoking and Chewing of Tobacco in Relation to Cancer of the Upper Alimentary Tract. This is by L.D. Sanghvi, note PhD, KCM Rao, MSc, and V.R. Khanolkar. L.D. Sanghvi was one of his early students. He had passed his MSc, and he had just gotten a job to sell insurance and to become an insurance salesman. But Khanolkar learnt of him and said, this is a bright guy. He should not be wasted in selling insurance. We should have him in science and in epidemiology. And Sanghvi became one of India's great epidemiologists. KCM Rao is Kasturi Rao, later Kasturi Jayant, also one of India's pioneering epidemiologists. So they published this paper on smoking and chewing of tobacco in relation to the upper alimentary tract. Dahl and Hill, Richard Dahl and Austin Bradford Hill, had shown in 1950 that tobacco caused lung cancer. It was then Khanolkar's idea, when she was at the ICRC, to investigate epidemiologically whether tobacco could cause upper alimentary tract cancer, and indeed, we know it did. His other fields of research, now obviously I've discussed cancer all this time, which you would expect from someone who has worked in a cancer hospital. But with Sanghvi, he worked on the epidemiology of the Rh factor in Indians, and he published this in no less a journal than Nature in 1945. He also worked on the concept of, in fact, they introduced or formulated the concept of dimorphous leprosy or borderline leprosy with Cochrane. It was also Khanolkar who showed that the high incidence of breast cancer among Parsis, it was detected by him. I'm going to change track a bit at this stage and tell you about this book, The Immortal Life of Henrietta Lacks. This was a fantastic book written in 2010 by Rebecca Skloot. And those of you who have not read this book, I strongly recommend reading this book. It's about the HeLa cell line and about the person behind it. And in March 2011, after reading this book, I emailed Rebecca Skloot and said, your book is truly outstanding, but on page 57, you state that George Gay, that's the guy who created the HeLa cell line, he sent the HeLa cell lines to India. May I know the reference for this? Where was it sent? I was curious to know if it was sent to Khanolkar in India, because he was the first pathologist. And I understand from his students that Khanolkar was interested in tissue culture. So was it him. That's 2011. 5 years later, I keep sending mails. Finally, in 2016, I sent a mail to Skloot saying, I'm certain you're incredibly busy, but I have been mailing you repeatedly now for over 5 years. Please let me know. This time, her secretary replies, Rebecca suggests reaching out to the John Mason Chesney Archive at the Hopkins. This is where she found the letters regarding shipping the cells to India. She thinks the name Khanolkar is familiar, but she is not absolutely sure. I emailed her then the next day saying, purely by chance, I learned yesterday that Kamal Randive, who was Khanolkar's student, went to George Gay's lab for a postdoc in the early 1950s and started cell culture in the 1960s. So it is extremely likely that Gay sent HeLa to India with her, but that is not evidence enough. So she replies to me now, not her secretary, that's a great piece of information in your quest. If Randiva did a postdoc with Gay in the 1950s, it's almost certain he would have sent HeLa cell lines back to India with her, because he kept doing it. I'd be very surprised if Randive didn't get HeLa cells in India, but you need to contact the Gay archives at Hopkins. The next day I replied to her and say, I spoke to Dr. Kasturi Jayant, Dr. KCM Rao then, today, and she says she doesn't remember Khanolkar ever using HeLa. And the fact is, he worked only on breast cancer and oral cancer. HeLa, as you know, is a cervical cancer cell line. So I don't know what really happened then. So then I emailed a historian friend of mine in New York and said, do you have access to the Chesney files? It looks like VRK and team did not use the HeLa cell lines, but I'm curious to know who used them. She replies, we'll just check. That's in 2016. In 2017, I sent her a reminder, this time not even a reply saying we'll just check. So I still don't know whether Khanolkar used HeLa. If not, who used HeLa cell lines in India? Now, very deep in history until very, very recently is this: Khanolkar's contributions to occupational health in India. Now, the Sir Joseph Hole Committee, which was from 1943 to 1945, had come out, and it did not think silicosis was a problem. But Khanolkar, as part of another committee, recognized in 1944 that silicosis was a problem among miners, silicosis and pneumoconiosis. This resulted in workmen's compensation and in the formation of better hospitals for miners in 1952. So although he was a cancer pathologist and an epidemiologist, he was also able to contribute to occupational health in lung disease in India. I think that is absolutely phenomenal. He also was asked to lead the ICMR position statement on what we now call Indian childhood cirrhosis, or what was then called infantile biliary cirrhosis. This was a paper published in the Indian Journal of Medical Research in 1955. That's not all. He also found time to be the president of the International Cancer Research Commission from 1950 to 54 and 58 to 62. He was also on the WHO panels on leprosy, radiation, and medical research. As we all know, he was the founder of the Indian Association of Pathologists and Microbiologists, but he was also one of the founders of Indian Society for Study of Reproduction and the Blood Group Reference Center, now called the Institute of Immunohematology. Okay, my colleague Rakshita translated this for me, and I'm grateful to her. This shows that Khanolkar was appointed honorary member of the Austrian Cancer Society in 1960 when it was 50 years old. Here's a photograph of Khanolkar at the extreme left. He's chairman of this obviously high-level committee. You can see behind translations in translators in French and in Russian, and you can see these guys also getting their translations into their ears. Here's another photograph of Khanolkar at another big meeting, and I put this photograph here only because I allowed one thing. This is a cancer meeting, and you are one of these members having a lovely, maybe Cuban cigar. This is another photograph of Khanolkar with the father of chemotherapy, Sidney Farber, the guy who started cancer chemotherapy for lymphoblastic leukemia in children. Farber was also one of the first pediatric pathologists, by the way. And when you are in the position of professor of pathology at Tata Memorial, you get to meet the president of India, that's Babu Rajendra Prasad. Khanolkar was an excellent teacher, and some of his students included, like I said, L.D. Sangvi, also C.G.S. Iyengar, Darab Dastur, the great neuropathologist, who incidentally was an MD in general medicine, who heard a lecture by Khanolkar at Nagpur IAPM conference and was so astounded that he moved into pathology. There's Kamal Randive and M.V. Shirsat also among his great students. But he was not just a pathologist. He was also a good tennis player. He was a polyglot who spoke English, Marathi, you'd expect, Hindi, Urdu, Pushtu, French, and German. And after independence, apparently he even tried to learn Russian. He liked hiking, and he designed his own house, which was apparently made of glass. And finally, he wrote absolutely top-class, edifying literature on the philosophy and of medicine. I have Dr. Sunil Pandya's email last week, and I have his permission to tell you guys this. In 1965, Robert Cochrane had retired from the Christian Medical College, Vellore as principal. Khanolkar and he had written chapters together in a book, and Shubha Pandya was working with Dr. Antia on a leprosy project. Shubha Pandya is Dr. Sunil Pandya's wife. He is, of course, the neurosurgeon and historian and ethicist in medicine. She was asked to help Dr. Cochrane with his program. Dr. Cochrane expressed a deep desire to call on Dr. Khanolkar. Shubha remembers accompanying him on this visit. By now, Khanolkar showed evidence of advanced Alzheimer's dementia. This is 1965. He did not recognize Cochrane. For several minutes, Cochrane tried to engage his attention, but in vain. Eventually, he walked over to Khanolkar and gently uttered, my friend, my friend." Deeply saddened, he turned and led the way out. Finally, Khanolkar passed away 13 years later in October 1978 at KEM Hospital, a hospital he was associated with in its early years. And soon after that, at the junction of KEM Hospital and Tata Memorial, or the Cancer Research Institute, Chowk was named after him, Dr. Vasant. Ramji Khanolkar Chowk. And the person on the extreme left is the then director of the CRI, Dr. M.G. Dev. And do note that this nameplate, this plate has the name in Devanagari as well as in English. But subsequently, a few years later, when I took the photograph, the English had disappeared. There's a new board and it's only in Devanagari. He was a genius in medicine who was awarded the Padma Bhushan in 1955. And somewhere in my collection, I have the newspaper cutting which says Khanolkar awarded Padma Bhushan. In 1995, I awarded the sobriquet of Father of Pathology and Medical Research in India to Khanolkar, and this has been accepted by people blindly, I would say, and passed on. And I guess I'm right, or at any rate, if I'm not right, it sticks with him. Now, Khanolkar Chowk, I already told you about, and the Indian Journal of Pathology and Microbiology awards a prize for the best paper, which is called the Khanolkar Prize. But unfortunately, there is no postage stamp or road or hospital in his name. I did try writing to the postal authorities in 1995 to get a postal stamp out. I failed. Maybe the IAPM can try again. And this is at ACTREC in 2019, I guess. They put up this bust of Khanolkar as the father of pathology and medical research in India. But for some reason, I see they got the dates wrong. It says founder director 1957 to 73. It should be 52 to 63 anyway. And I also wrote to Cancer Research, and Cancer Research put him on the cover of Cancer Research in the August 15th, 1999 issue, and had a whole page on him. And in 2016, I got an email from Jan van den Wiel, a pathologist in the Netherlands, saying we are coming out with a book on pioneers in pathology. We are going to have 205 biographies of 205 pathologists of all time, the greatest of all time. And we have decided to include one Indian in that, Khanolkar, and would you please write the essay on that? And of course, I did write the essay on that. It was an honor to write about Khanolkar in this. So what are the lessons that we can learn about Khanolkar? What made him a Renaissance scholar and what can we learn from him? I think one of the things which makes a difference is that he trained abroad. He trained in India and then he trained abroad, and that gives you a different perspective. It was clear and focused. He did not waste any opportunity to do research on anything which interested him. And fortunately for us, everything interested him. He encouraged youngsters, especially in different fields. Like I told you, Sangvi was going to sell insurance. He was brought into medical research by Khanolkar. He was patriotic, and there's something very interesting out here. He encouraged all the youngsters to go abroad and present their papers. Because he believed that these youngsters were representing the nation, he ensured that they were dressed in the best of clothes. He sent them off to make suits and wear the best of clothes, all of which was paid for by himself, because he believed they were representing the nation. And finally, this, he was a late bloomer. From 1895 to 1940, except for that, well, okay, from 1922 to 1940, except for that one paper which he published in Journal of Fact and Back, he has no papers. We know absolutely nothing about what he did. But from 1940, at the age of 45, he starts publishing in the best of journals and does great research. So my advice is, if you are up to 45 years old and have done no great research, it's no problem. You can start now. If Khanolkar could do it, so can you. I'm coming towards the end of the talk, and a little bit about the Khanolkar family. His father was a doctor in the army. Khanolkar was one of 8 brothers and a sister. His wife was Marcel Jean Presch. He had one son and a daughter, but he had one younger brother, Major General Vikram Khanolkar. Why I'm talking about his brother is, okay, this is a picture of Khanolkar and his wife. You know this Paramveer Chakra and Ashok Chakra, right? So these medals were designed by Savitribai Khanolkar. That's the wife of Major General Vikram Khanolkar. She was born Eve Yvonne Mede de Maros. She was a Swiss woman who got married to Major General Khanolkar, came to India and identified herself as an Indian. She spoke fluent Marathi, Sanskrit, Hindi, learned Indian music, dance and painting, and designed these awards. Amazingly, incredibly, the first Paramveer Chakra was awarded to her elder daughter's brother-in-law, Major Somnath Sharma, who died in 1947 during the Indo-Pak War. I think that is an absolutely fantastic coincidence. Okay, all of these facts that I told you is through a lot of research through the net over the years. And two people helped me out with this, students, Dr. L.D. Sangvi and Dr. Khanolkar, who spent time with me in 1995 and gave me information on Khanolkar. Thank you.
Thank you, Dr. Pai, for that wonderful talk. You took us back in time and you reminded us about the immense contribution that has been made by Indian pathologists, especially Dr. Khanolkar. We are so fascinated about international pathologists that we sometimes forget there are so many legends here itself. We should have this more often. Before we move to the next talk, I'll have something fun that we did at KCIAPM today to observe the National Pathology Day. We allotted one letter each to each of our 23 medical colleges across the state. They stood in the formation of National Pathology Day, and we compiled it all together to form the National Pathology Day. Just enjoy this brief 1-minute video, and then we'll move on to the next talk. Okay, so that way we formed the entire collage of National Pathology Day, and that involved almost 550 plus pathologists from across the state of Karnataka. Now, moving on. I now invite Dr. Asrantika, Secretary KCIAPM, to introduce our next faculty for the day, Dr. Kim Vaifai. Dr. Asrantika, ma'am, over to you.
Yes. So at the outset, I extend a warm welcome to all those present here, including our president and past presidents and all issue members and the pathologists. I can feel the excitement and the happiness among all over India for celebrating this National Pathology Day. I hope we will extend it and do it in a bigger way in the coming years. Now, we are privileged to have Dr. Kim Vaifai among us. He is Professor, Department of Histopathology, PGI Chandigarh. Currently, she is President IAPM. She has remained the Vice President of IAPM in the year 2020 and 2021. She is Fellow of UICC WHO, Indian Academy of Medical Sciences, and ICT. She has published more than 300 publications in national and international journals, and has recently written a book on pathology of gastric biopsy. Her field of interest is gastrointestinal, hepatobiliary, and cardiac pathology. And she has received numerous national and international awards. And she is the best person, I think, to talk on this first National Pathology Day. And she will be delivering her lecture in pathology, in morphology in pathology, my perspective. I invite Dr. Kim Vaifai, madam, to give her lecture.
Okay. Thank you very much, Dr. Asrantika, and thank you, Dr. Aditya. Can I share my slide now?
Please do.
I think you have something is coming on.
At the bottom of the screen, there's PowerPoint button. Just tap on that. Yeah, minimize it. Minimize it.
Yeah, I think you have to minimize this.
Yes, ma'am. We can see the screen. Thank you.
Uh, the topic which I have chosen is very vast. And so I'm going to have very unconventional approach. And our audience includes both the young trainee pathologists and also senior pathologists. And so I have a few slides, the first few slides for the young pathologist, and later on it's for all. And so I would be making my presentations under these 4 headings. One is the background history of pathology. Another is the second one is the background history of microscopy. Then outlines for morphology and exemplification of morphology based on few interesting cases. Now, what is a pathology? The definition of a pathology, if anybody asked, a science that refers to causes and effects of disease, and it deals with lab examination of samples of body tissue for diagnostic purposes. And so it also addresses the cause, the mechanism, so many things which we all know about. And then it may be divided. There are various subspecialties, but on the whole, I feel that it can be divided into clinical and anatomical. And then type of samples can be cytopathology, hematopathology, and histopathology. And also immunopathology is coming up in a big way. So a brief history of pathology, if one goes back into the history, there is no single event which demarcates beginning of pathology. But if one looks into the history, the pathology had been rooted very deeply both in the medical field and also surgical fields, because all these clinicians used to examine tissue under the microscope so that they can come up with their diagnosis. And the important documents, actually, some of the important documents started off during the Egyptian medicine, though the documents which were available were very sparse. And these date back to 17th century and 15th to 16th centuries. And so, though Egyptian dynasties had lasted more than nearly 5,000 years, and then they had embalmed thousands of human bodies, but those papyri means the paper, which is some paper, special paper made from some materials from grass and all. So they referred this as the papyri. And so from this dynasty, those documents which are written down on these papers were very sparse. There was hardly any proper documentation of any particular disease conditions. But more lately, investigations which had been carried out on the Egyptian mummies had identified various types of diseases, including bone tumors, spine tuberculosis, atherosclerosis, gallstones, abscesses, and extra. And the person who had contributed maximum was Alexandrian Greeks. This is the documentations had taken place 300 before Christ. And now coming to the Hippocrates of Kos. Kos is a place in Greece where Hippocrates was born. And so Hippocrates and his school or his students had great impact on Greek and Roman medicines. And there had been many flaws in their theories, but in spite of that, they had a great contribution in the history of pathology. They had described the wound inflammation, they had described the tumors, hemorrhoids, malaria, and tuberculosis. And now coming to the microscope. And when we talk about the microscope, the cell theory, we cannot really go away from the Virchow. Virchow was known as the father of modern pathology. He was the first person who had described under the microscope the structure of a cell. And so origin of microscopic pathology was invented 150 years after invention of the compound microscope. And Julius Conham, who was Vercoe's student, was the first person who had described inflammation and also was a pioneer on demonstrating or carrying out frozen section procedures. And so this is a history of microscope, how the microscope had developed. The first microscope, which was a compound microscope, was designed by a son and a father who were Dutch eyeglass makers. And then the last one, Antonio van Leeuwenhoek, he was a cloth merchant, possibly he used to use, and he had a simple microscope. He had invented this to examine possibly his cloth materials. And now coming to the morphology. So what is a morphology? So this is study of shapes and appearances of cells, tissues, and other organs which are present in the body or human body or animal or anything in the experimental model. And pathology is the study of anything which is distorted from the normal structure, which is usually described in the literature as anomalies, and it can be either microscopic or macroscopic. And now coming to the macroscopic examination, these are meant for the youngsters. And every time when you are going to examine anything, you are going to talk in context the normal structure or normal anatomy for that particular site. So one has to mention and examine the size, the weight, the shape, the color, and consistency. These are some of the things which one should not overlook, and one should really try and make a kind of a chart where you describe the gross findings in very disciplined manner so that you do not lose out anything or overlook anything. And the next one, we come to the microscopy. This again is something which we have to recognize the structures which we are going to see under the microscope from the samples which we have taken during the time of grossing. So the microscopic examination per se again is very important in context of the gross findings, except in small biopsies. Even in small biopsy, one has to take into account the clinical situation where and what kind of a small biopsy it is. Is it a needle through cut biopsy, whether it is a skin biopsy, whether it is an endoscopic biopsy. So one has to have a clear-cut history, the background history, and also the findings, maybe by the naked eye and maybe by the microscopy. And while examining under a microscopy, one has to identify the cell or the tissue type corresponding to the site from where the biopsy had come. And so corresponding to it and interpreting it and correlating is very important. So the background knowledge is very important while interpreting any kind of microscopy. And appearance of the mass or the lesion under the microscopy, again, whether one can see. So you have to all the time start from the scanner, the lowest, the 2x, and so for histopathology, and you have to start from 2x and go to the 4x. But for cytology and hematology, possibly you do not need to use a 2x and a 4x, but you may start from 10x. So examining a slide under the low power view is very, very important. So the students should not take a shortcut and start from the high power, then directly you are going to the high power and you are seeing the cells, and you are not really seeing the pattern which the cells are being arranged. Whether it was a single mass, multiple mass, a nodular, encapsulation, infiltrative margin, there are so many things which one has to look into. And so the microscopy per se also is very, very important. And bottom line is that you have to spend time. You cannot do really anything in a hurry. So now coming to the cells, and then while examining the cells per se, is it one type of cells or is more than one type of cells? Accordingly, we say monomorphic type, pleomorphic type, and I hope you all know what is a pleomorphism. And so polymorphism, pleomorphism, they are very different. Pleomorphism is one type of cell with different shape and sizes. Polymorphism is various types of cells, different, like hemopoietic cells. All the hemopoietic cells, we are going to refer to the polymorphism. It's not pleomorphism. And so the arrangement of cells, lately I have realized, even in my institute, the residents are really not bothered about the pattern, the pattern that the cells are arranged. this is very, very important. If one is going to write out a good description, you have to start under low power view, how the cells are arranged. Is it diffuse sheets? Is it in groups, small or large clusters, nesting? And one should not really interchangeably use a small cluster and the nest, which is very frequently the residents are doing it. So you have to learn what is a small nest, a small cluster, and what is a nesting pattern. These are totally different structures, and the cells, when they are, is it arranged in single cord, double cord, or trabeculae? These are definite criteria and definitions are there where one has to learn about them. And so reading a textbook is very, very important. Just trying to manage with the hearsay is not the right thing to do. Somebody may guide you, but ultimately you have to read the textbook so that you come up with the right kind of impression, the right kind of description. And the stroma, again, collagenization and desmoplasia are not the same. So this has to be, again, you have to try and differentiate between what is a collagenization, what is a fibrosis, and what is a desmoplasia. And now the cell size, again, coming in detail, whether it's a small cell, intermediate size, or the large size. And the shape, again, whether uniform, variation, monomorphism, pleomorphism, or polymorphism. And so all these variation, again, could be just a mild, maybe moderate, or it could be extensive. And apart from that, one also has to pay the attention to the cytoplasm, the character, the color, the amount of the cytoplasm, the cell membrane, whether it's syncytial end type, or it has a well-defined cell outline, the cytoplasm character, whether they are inclusions, whether they are pigments. All these should be mentioned and look for while one is examining any kind of slight injections. And then nuclear anomalies, the size of the nucleus in context of the original size of the cell from which any lesion or a tumor is arising, or the nuclear, whether there is enlargement, the chromatin pattern, the nucleolus, the nuclear membrane. One has to sit down and look the nuclear membrane per se, because you would learn many things if you try and see all these things in detail. And so whether it is hyperchromasia or there is vesiculation, if there is vesiculation, then only you would see the nucleolus. Otherwise, in hyperchromatic nuclei, nucleolus are not really very well visualized. Any other abnormal structures, which can be intracellular, extracellular, and also one should not forget to look for the mitosis. Mitosis could be the normal or it could be abnormal, and one has to do accordingly, appropriately do the counting. Now, this is coming to the morphology features of few interesting cases, which I just managed to collect from my day-to-day routine things. And now this is, we all know that this is a needle biopsy of the liver. And then we see to the high power here. There are various changes in this. The dominant finding here is what one can see is the fatty changes. And dominantly it's a large fats or a macrovesicular, we call it, though it is intermixed with microvesicular. There are pericellular fibrosis, there are cholestasis, and then in the right hand upper lower corner here, one could see the pericellular fibrosis as highlighted in mesenteric staining. And high power view, one could see that some of these bloated up cells has some structures like this. Here also one could see some structures like this, and there are some inflammatory cells in around this vacuolated cells is also are comprising of neutrophils. So one would call this as cellulosis in a given liver biopsy. And now this is another area here where one could say that there are a lot of these structures, pinkish intracytoplasmic structures, which are irregular. The textbook says all the time they're ropey. And I will warn the residents that they are not really ropey. They are very irregular clusters of some structures which are of variable shape and sizes. If you're all the time looking for the ropey, then you are going to miss these structures all the time. And here also another. So all are variable shape and sizes. And then this is in mesenteric staining. In mesenteric staining, these structures all the time stands out very well. And so we have to deal with a lot of autopsy materials in our center. They do show a lot of degenerative changes in that setting. H&E sometimes becomes slightly difficult to identify these bodies, these structures. And so in that setting, if one uses mesenteric, then they stand out as a bright red color, dark red color. So it's very easy to identify them in mesenteric staining. That's what we usually routinely do it, apart from trying to demonstrate the pericellular fibrosis. And so those, we all know that we know that it's called as Mallory hyaline bodies. And so we just talk 1 or 2 slides about the Mallory hyaline bodies, also known as the Mallory-Dank bodies. This is cytoplasmic hyaline inclusions in hepatocytes, can be seen in many liver diseases. I was quite fascinated in Dr. Pai's talk when he was mentioned about the Indian childhood cirrhosis. This is a condition which has been written up as a disease of the past, but I do not think so. So that the pediatric hepatologists should be aware of this particular condition. Otherwise, most of the time, these conditions are misdiagnosed as autoimmune hepatitis. And so Mallory-Dank body can be seen in many conditions, beginning from alcoholic hepatitis to NAS. In NAS, they are much lesser in amount. One has to really look for them. And other cholestatic liver disease, primary biliary cirrhosis, including many drugs also can produce, and hepatocellular carcinomas. And it was first time identified in 1911 by Frank Burr Mallory in alcoholic hepatitis. And later on, almost 60 years later, Helmut Denk identified that in experimental animal model who had been fed with crisofulvin. So hence the name Mallory-Dank bodies. So it is combination of 2 persons who had seen them for the first time under separate conditions. And so morphology wise, they are damaged intermediate filaments. If I ask my students, what is the cell of origin? What is the morphology of these Mallory-Dank bodies? They will tell me about the ubiquitin. The ubiquitin is the molecular, is not the morphology. The morphology is the intermediate filaments, which one may not be able to see normally under light microscopy, but you can see them under electron microscopy. So the residents should be able to differentiate what is a morphology and what is a molecular. So this is another very important aspect where now with the upcoming of lot of molecular pathology, the residents are slightly confused. So it is duty of we senior people also to teach them what is a molecular and what is a morphological changes. Otherwise, there are a lot of confusion which is going on in their minds because they are learning. They're in the process of learning. They are very volatile. So I think we have to guide them properly, teach them the right understanding of these terminologies, and so that they can apply them properly in day-to-day their routine practice and experience. And so these Mallory-Dank bodies, there are 3 types have been described. One is the parallel filaments, another one is randomly oriented filaments, which are usually tend to be located towards the periphery of the hepatocytes and believed to be more mature form. And the type 3 is granular and amorphous bodies, which are usually tends to be located near the nucleus and believed to be early form. And so in primary biliary cholangitis and Wilson's disease, these are usually located in the zone 3 of Rappaport and zone 1 in ISN in Nafeld. This is in steatohepatitis. And immunohistochemistry staining is very helpful. It highlights very well for CCAN, ubiquitin, and also P62 can be used. And cytolytosis as neutrophils is around the hepatocytes, with the Mallory-Dank bodies, which I already shown one photograph. And the molecular pathology now is this oxidative stress. Usually believe that high fat diet is the initiating factors for this oxidative stress. And so there is unfolding of these intermediate filaments and ubiquitination takes place. And that's how all these things and the toll-like receptors are stimulated. So there is that stimulates, leads on to the inflammatory pathways in short. That's how we get this kind of inflammatory lesions in NAS and other conditions where you get Mallory-Dank bodies in liver biopsy. And so this is the electron microscopy picture of Mallory-Dank body, the nucleus in the paranuclear area. And so this is the immunostaining, keratin, P62, and ubiquitin. So that is all about Mallory-Dank body, which I felt that I need to just talk about, and so that at least the residents get some information more than the routine things. And I'm sure that my senior colleagues are very well versed with this, and I don't think anything is new to them. And now we come to another case where the morphology is in and all. So the first one also in that Mallory-Dank body, everything is morphology. You do not really need anything more than that in order to be able to identify and Also the immunohistochemistry. So one doesn't really need to go down to the molecular and the big molecular thing, including the NGAs, which we talk day in and day out nowadays. So one can be happy and satisfied and correctly make the diagnosis only with the light microscopy, and maybe sometimes in one needs to, one can use the histochemistry, but may not be really necessary and essential all the time. And as one can see that this photograph, this is root of the aorta. Here one could see that is the aorta, the endothelium. The inner surface is totally rough and nodular, and the wall of the aorta also is grossly thickened. And these are the great vessels which is arising from the arch of the aorta. One could see that the lumen is almost totally occluded. This is the abdominal segment of the abdominal aorta, and here also similarly the lumen is like the lead pipe and with grossly thickened, and the endothelial side or the inner aspect is totally granular, nodular, very roughened and irregular, and that is mainly above the, and that is these changes were seen mainly above the level of the renal arteries. And so beneath that, the abdominal aorta was relatively normal, was uninvolved. We will not go into the classifications in detail. So I just want to show is the histology, where one can make a diagnosis only by morphology. You do not really require anything more than that. And so I am a person who still believes that my HNA is the most important section and staining for me to be able to diagnose more than 90% of the conditions as a histopathologist. So this is one low power scanner view of the aorta. Here one could see the intimal plaque, and the media is almost totally being destroyed. The adventitia grossly thickened, and these are the vasovasuram, which becomes so prominent. Normally, one has to look for them, but in this certain condition situation, you do not really need to hunt for them. They just stand out and look at you. This is the EBG stain. There's a little bit of artifact here. Otherwise, see the media is the elastic tissue is totally being destroyed, fragmented, and is replaced by collagen. The reddish or the magenta color, the reddish colors are the fibers, the collagen, and dark green is the elastic tissue, which has been totally being destroyed, near totally being destroyed. Another area here, one could see that this is the intima, and there are inflammatory cells which are coming up in the media with replacement fibrosis. The adventitia is grossly thickened, and so vasovasuram, we all the time say that it is present in the adventitia, but no, it is also been seen in the media, especially the outer half of the media. All the time will have plenty of vasovasuram under such conditions. And so these are inflammatory cells, pigments, and this is a vasovasuram where one could see the onion staining. Special stains, AVG, mesenteric trichome, just to highlight, bring them out much better. And then this is for demonstration teaching purpose, is one of the CPC cases. So majority of the cells were CD3 and CD8 positive, few scattered CD20 positive, and the coronary artery was spared in this particular case. So this is a classic case of Takayasu's arthritis. Takayasu's arthritis, we know that it involves usually larger vessels. So it is all the time being interpreted as a disease of the larger vessels or large vessels. No, it is a disease of the smallest size vessel, in which are very richly present in the large size vessels. And so that's the reason why the large size vessels are involved, but it is a disease of the vasovasuram. Now coming to another case, this is inferior vena cava. This is one of my CPC case which I had done in the recent past. And so aorta and everything, the arterial systems were totally normal, and there's a stent which has been placed here because he's a young male, he was around 20 plus, and so recurrent thrombosis, including the pulmonary arteries, and also this is totally occluded with the stent here. This is the inferior vena cava. The interesting point is that what I wanted to highlight in this case, similar kind of findings in the veins in the wall. This is a thrombus. This is the totally fibrotic and thickened vein, and these are the smaller veins. And here one could see that the vasovasuram in the surrounding areas are totally occluded, thickened, and along with a lot of inflammation. So these kind of Takayasu's here also another area. And so it's been really not been described in context to the venous system. So I was just wondering, when we were discussing this for the CPC also with my clinical counterparts, so we came down that we have to look for, keep our eyes open, maybe that because the large vessels or veins are also very rich in vasa vasorum, that could be the reason, or that could be the reason that they can also be showing similar kind of changes where this is a disease of the smallest vessel. So this is what I want the audience, my senior colleagues also to think about, and you all can give me your feedback, whether what do you think about this? Is it Takayasu phlebitis? Can we label this condition as Takayasu phlebitis? Because this particular patient had been thoroughly investigated. There was the coagulation profiles were fine, everything was fine. There was no all the factor V latents and everything else was, there was no mutation, everything was fine. So we could not really pinpoint what could have been the cause for his this recurrent thrombosis, which led on to his demise. And the last case, I don't know, Aditya, how much time can I start?
Yes,
Hello?
ma'am. Go ahead. Finish it off.
Okay, so this is interesting case, and this would be the last 28 years old male. He presented with shortness of breath for 6 months, and he had a dry cough for 1 month. He gave history of intravenous injection of tramadol tablets after powdering it for 20 days, 6 months back. And his problem started off for the last 6 months, possibly after taking those intravenous drugs. And then in its chest X-ray, in the present presentation, there was lower lobe consolidations and ground glass opacities with septal thickening. And this is the autopsy lung. The lungs were slightly normal overweight, and then the pleuras were thickened. And this is a cut section of the lung, and it was solid. It was solidified. There was no thrombus. Thrombus was not really seen. The bronchial tree was standing out, though there was no definite bronchiectasis. And the lymph nodes were not really significantly enlarged. This is low power view of the maximally involved area of the lung here. One could not really see the septal properly also. Everything is solidified. And so cytokeratin 7 was done just to highlight the wall of the alveoli. So the one could see that the lumen is totally being packed with some those cells. And it's a high power view. I'll just come directly to what I want to show. These are the blood vessels. The blood vessel, one could see this containing some kind of bluish material, crystals. All the blood vessels, these are more or less present only selectively within the blood vessels of pulmonary arterial branches. This is one more section from relatively uninvolved area, but those structures were selectively present within the pulmonary arterial system. And so high power view here, one could see the flat bluish materials, and it is showing birefringence. Yeah, and this is the low power view of large areas. Is corresponding to the blood vessels. Those birefringent structures are present. Even in the myocardium also, those structures were present. Also in the kidney, I'm not showing the kidney slides. So it's a case of intrapulmonary tulcosis. So this is supposed to be a very rare condition. So I just would like to share the importance of morphology without any other special technique. You can still make in majority of the cases in histopathology a definitive diagnosis. Thank you very much for your kind attention. Rita, that's over. Thank you.
Yes. Thank you, ma'am, for the excellent talk. And I started, it's really didn't get justice to the topic morphology and pathology. We started from the history, covered different morphologic patterns, and finished with 3 very interesting cases. It was a really good one. I thank you profusely. Now, Dr. Aditya, we can start the next part.
Yes, thank you, ma'am, Dr. Kim, for the wonderful talk. I can see Dr. Harshmohan here, and welcome, sir, for the meeting. And
Sir wanted to say something, Dr. Harshmohan. He raised
Dr.
his
Harshmohan, would you
fingers.
like to say something about National Pathology Day? Meanwhile, I'll request all the PG finalists, top 6 PGs, for the quiz to start the video and audio. We will be starting with the quiz very soon. Yes. Okay. Fine.
Yes, madam. Meeting मध्ये.
Hello, everyone. Moving to the next program of the evening, the most awaited part, that is the PG quiz finale, the National Pathology Day Quiz 2022. This is a new initiative that has started this year, and hopefully it will become bigger and bigger in subsequent years. This year itself, we received a very huge and amazing response from all the delegates, PGs across the country. We had more than 230 registered PGs who registered for the quiz from more than 25 states across the country. So we had a tough task of narrowing it down to the top 6. So for that, what we did was we conducted a round 1, which had 100 MCQs, and the PGs got 60 minutes to answer them with negative markings. This was a screening round just to eliminate the most of them and bring down the volume to 30 top PGs. And for those top 30 PGs, we subjected them to another round of tough quizzing with 30 case-based MCQs and gave them just 45 minutes to answer them with a very high negative marking rate. From that, we have chosen the cream of the cream, that the top 6 students who will now be part of the quiz finale. So they are, the top 6 PGs are Dr. Abhishek Singh from Kamad Hospital, Bengaluru, Karnataka. Dr. Shubha MS from Rajgiri Hospital, Aluva, Kerala. Dr. Divya PJ from JJM Medical College, Davangere, Karnataka. Dr. Surendra A, Stanley Medical College, Chennai, Tamil Nadu. Dr. Rupashri from Jipmar, Pondicherry. And Dr. Aishwarya K from PGIMEA, Chandigarh. I welcome all 6 of you to this quiz. You've already been through a very tough 2 rounds of quizzing. And for all of us here at IAPM and KCIAPM, you're already winners. And this one will just a front row, enjoy it. And we will have the top 3 chosen from amongst you tonight. Conducting the quiz today evening are the quiz masters, Dr. Anita P. Javalgi, Professor of Pathology at SGM College of Medical Sciences and Hospital. Dr. Ranjana Ranade, Assistant Professor at SGM College of Medical Sciences and Hospital. And Dr. Aditya Agnihotri, Assistant Professor. I'll be the 3rd quiz master. And along with me, there'll be Dr. Basavraj Yamkan Marudi, Assistant Professor, SGM College of Medical Sciences and Hospital. So PGs, Dr. Abhishek, Dr. Shubha, Dr. Divya, Dr. Surendra, Dr. Rupashri, and Dr. Aishwarya. Are you ready for the quizzing? I want a loud yes from you guys.
Yes, sir.
Yes, sir.
Yes, perfect. Doctor, let me just check your audio once before we get started. Abhishek, I just checking your audio.
Yes, sir. I'm
Dr. Shubha.
Yes, sir.
Perfect. Dr. Divya.
Yes, sir.
Dr. Surendra.
Yes, sir.
Dr. Rupashri.
Sir.
And Dr. Aishwarya finally.
I'm here, sir.
Yeah, thank you. So everybody's audible. So I think that's time for the quiz. Okay, grand finale of the quiz. Let's get started then. Before we get started, I'll just announce the brief rules for the quiz. So the general rules are for the quiz are there'll be 5 rounds in total, along with 4 regular rounds and 1 rapid fire round. For each round, we will announce the theme of that particular round. There'll be no negative markings in this particular quizzing. The quizmaster decision is final and binding. Each question will have a time limit based on the theme of each round, and that will be announced before each round. The order of the PGs to answer the question will be different for each round. Say, for example, if we begin with Abhishek in round 1, we will begin with Dr. Shubha in round 2, just to be fair, because there is 1 passing allowed. Scores will be announced at the end of every round. We'll wait for it, and then you can start the next round of quiz so that you can plan your quizzing. So shall we get started?
Yes, sir.
Yeah. Any doubts? If you have the PGs, here's the time. If you can ask the questions now. Dr. Abhishek, Dr. Shubha, Dr. Divya, Dr. Surendra, Dr. Rupashri, Dr. Aishwarya. Any questions? Ask now so that we can get started. If there are no questions, please say so that we can continue.
no questions, sir.
Perfect. Just we want you all to enjoy yourself today, and we will start easy, slow and easy, and the questions will get tougher as the rounds go on. Okay. So Abhishek.
Yes, sir.
So the first round one question will go to you. Okay, we'll begin with you for the round 1A. Round one will subdivide into round 1A and 1B. 1A, we will start with you. Okay. So for the round 1A, you'll have to identify a pathologist. We'll put in two images there. One is of a pathologist and the other is of his contribution. And you'll have to identify the both. You'll have to name the pathologist and you'll have to also name the diagnosis of the slide, both together. So the rules are you'll have to identify the pathologist and its contribution. If you answer both, that will fetch you 20 marks. If you just identify one, that will get you 10 marks only. So the time provided is 45 seconds and only one pass is allowed. So if Abhishek doesn't answer, that will go to the next person, that is Subha. And if Subha doesn't answer her question, that will go to Dr. Divya. There are no negative markings and the quiz master's decision is final and binding. So Abhishek, are you ready for the round 1A first question?
Right, sir.
Right? Okay. Remember, you have 45 seconds to answer that. Identify the pathologist and this contribution.
So this is Dr. V.R. Khanolkar, and he's worked on
What does the first image show?
leprosy and tuberculosis, sir. Lupus vulgaris.
Okay, you have 10 more seconds to identify it. We have one word answer. That's all mentioned by Dr. Pai earlier.
Tuberculosis, sir.
Your time's up. The answer is, you've got a partial answer, right? It's Dr. V.R. Khanolkar, but what the image shows the dhoti cancer. Dr. Pai had shown a similar image earlier in his talk. Okay, done. Dr. Shubha, this is the question for you. Time is 45 seconds.
Papinicolo and the Papstini.
You'll have to identify the diagnosis, give the diagnosis of the slide, not just the stain. Name the pathologist and provide the diagnosis. 25 seconds remaining.
His scientist name is Papinicolo and the diagnosis is
15 seconds remaining. 9 seconds. 4, 3, 2, 1.
Does this get passed, sir, to me?
Yes, no, it doesn't get passed to you. Dr. Divya can take that question.
Is it squamous cells on the first image?
I want a complete diagnosis, please.
Squamous cell carcinoma of the cervix?
Yes. Done. So the answer is George Papanicolaou and the squamous cell carcinoma of the cervix. Dr. Shubha will get 10 marks for partially answer, and Dr. Divya will get 50% of the marks for the second one. That is 5 marks. Okay. So next is to Dr. Divya. Dr. Divya, here's your time. Your time starts now.
Rudolph Virchow?
I want a complete answer. Name the pathologist and the diagnosis.
Rudolph Virchow and signs of inflammation, identification or detection of the bacilli, lepra bacilli or tubercular bacilli.
Better. 15 seconds. 9 seconds. The diagnosis first slide. 5 seconds remaining.
Acid fast bacilli.
Not a complete answer.
Past question.
The question now gets passed to Dr. Surendra. You can
Lepromatous leprosy, sir.
Very good, Dr. Surendra. So the answer is Rudolph Virchow and Virchow. Those are the Virchow cells, and the diagnosis is lepromatous leprosy. Okay. All right, Dr. Surendra, are you ready with the next question?
Yes, sir.
Okay, here it comes.
The pathologist is a ventricular and the diagnosis is retinoblastoma.
There are no negative markings. You can try again, 30 more seconds.
Pathologist is Homer Wright, sir.
15 seconds. Ten, 9.
Medulloblastoma, sir. Slide is medulloblastoma.
3, 2, 1. Dr. Surendra, your time.
Okay.
That question now gets passed on to Dr. Rubashri. You have 30 seconds. Dr. Rubashri,
Yes, sir.
you have 30 seconds. Name the pathologist and the diagnosis there.
Neuroblastoma.
Name the pathologist and the diagnosis. Rubashri, you have 10 more seconds. Done. So the answer is, that's Dr. James Ewing, and that's Ewing sarcoma. Okay. So
Yes.
the next question goes to Dr. Rubashri. Are you ready, Dr. Rubashri?
Yes, sir.
1-5 question. You have 45 seconds.
Langerhans cell histiocytosis.
Name the pathologist and the diagnosis, both. Name the pathologist and the diagnosis.
Langerhans.
Yes. So the diagnosis is, that's Dr. Paul Langerhans, and the diagnosis Langerhans cell histiocytosis. You get full 20 marks for this. Okay, Dr. Aishwarya, are you ready for your question?
Yes, sir.
Okay, here it comes. You have 40 seconds remaining. Identify the pathologist and the diagnosis in that side. Twenty seconds to go. 15 seconds. Dr. Aishwarya. Identify the pathologist and the diagnosis. Last 5 seconds. 1. Time is up. The question now gets passed on to Dr. Abhishek, 30 seconds.
This is the Hungarian physician, Moritz Kaposi, and this is Kaposi sarcoma.
Very good. Very good, Dr. Abhishek. That's your answer, Dr. Moritz Kaposi and Kaposi sarcoma. 10. So we have now completed the round 1A, part A of the round, and it's time for round 1B. Now, here in this round, you'll have to identify the syndrome. What we will mention is a series of findings which are characteristic of that particular syndrome, and then you'll have to name the syndrome. Are you ready? This round again will have 45 seconds. Correct answer will fetch you 20 marks. The wrong answer will not fetch you any marks, but it gets passed on and the subsequent person will get 10 marks. Got it? So this round we will be starting with Dr. Shubha. Dr. Shubha,
Yes.
are you ready?
Yes, sir.
Here's your set of symptoms. Sorry. Identify the syndrome based on the hallmarks that will fetch you 20 marks. The time provided is 45 seconds. One pass is allowed, and the next person will get 30 seconds. And the correct answer will fetch 50% of the marks. No negative marking, and Quizmaster's decision is final. So here the first question is.
So the passing will be now from the quick participant number 2 to 3, and this
Yes, 2 to 3. From 2 to 3 now.
That's it.
Yes. Okay. Dr. Shubha, are you ready?
Okay, sir. Yes, sir.
Identify the syndrome.
Sclerosis.
Louder, please.
Tuberous sclerosis.
Okay. Very good. So the answer is tuberous sclerosis, hypomanelic pap macules, SEGA, the subependymal giant cell astrocytoma, chagrin patches, seizures, facial angiofibromas, subungual fibroma, all are features of tuberous sclerosis. Very good, Dr. Shubha. We'll move on to the next person. Dr. Divya, are you ready for your question?
Yes, sir.
Fine. Here it comes. Name the syndrome.
Turcot syndrome.
You may try again. No negative markings.
Gardner syndrome.
Very good. Gardner syndrome, multiple colorectal polyps, desmoid tumors, osteomas, epithelial cells, adrenal gland tumors, and congenital hypertrophy of RP, retinal pigment epithelium is characteristic of this. Okay. So the next question will be for Dr. Surendra. Are you ready?
Yes, sir. Yes, sir.
Okay, here it comes. 45 seconds.
Beckman Width syndrome, sir.
Slightly better, partially right. Name it again.
Beckman Width syndrome.
No. You're close. You can try again. 20 seconds to go.
Beckwith-Wiedemann syndrome.
Very good. Okay.
Yes, sir. Thank you.
So that's Beckwith-Wiedemann syndrome for you. Macrosomia, macroglossia, omphalocele, embryonal tumors, and cytomegaly of the fetal adrenal cortex and visceromegaly. All are characteristic features of that disease. Fine. So the next question is for Dr. Rubashri. Rubashri, are you ready?
Yes, sir.
Okay, here it comes. Thirty seconds to go. Last 15 seconds, Dr. Rubashri. Identify the syndrome. Dr. Rubashri, your time is up. So the question now gets passed on to Dr. Aishwarya. You have now 30 seconds, Aishwarya, to answer this.
Von Hippel-Lindau syndrome.
Try again. Ten more seconds. Occipital encephalocele, polycystic kidneys, postaxial polydactyly. 5 seconds remaining, Dr. Aishwarya. Okay, your time is up. The answer is Meckel-Gruber syndrome. Okay. This is a triad of Meckel-Gruber syndrome. So the last question of this round, so the next question of this round goes to Dr. Aishwarya. Aishwarya, are you ready?
Yes, sir.
Fine, there it comes. Yes. Name the syndrome.
DiGeorge syndrome.
Try again. 35 seconds left remaining.
Catch-22 DiGeorge syndrome.
Yes, you said something?
Sir, Catch-22 DiGeorge syndrome.
Very good. Catch-22 is a mnemonic, but okay, this is a DiGeorge syndrome. You get full 20 marks. Okay, so microdeletion of chromosome 22 to 22, birth defects that affects the immune system, facial features, low set ears, wide set eyes, and small jaw, all are features of DiGeorge syndrome. So the last question of round 1B goes to Dr. Abhishek. Abhishek, are you ready?
Yes.
Okay, here it comes. 45 seconds. Yes, time starts now. Butterfly vertebra, posterior embryotoxin, and triangular facies. It's a triad of one particular syndrome. Name the syndrome. 35 seconds to go.
So, Allergic syndrome.
Very good. You hit the nail on the head. It's Allergic syndrome. You get full 20 marks for this. So that completes the round 1 of the quizzing. We will now tell you the scores in just under a minute, okay? Right.
So you're on mute.
So I
So here are the scores for round 1. Abhishek, Dr. Abhishek 40, Dr. Subha 30, Dr. Divya 35, Dr. Surendra 25, and Dr. Rubashe and Aishwarya have 20 points each. Okay. So we'll now move to round number 2.
so a doubt, sir. For the questions that get passed, we get half the points.
Half the points, only half the points. Okay. So we'll move on to the next round. Beginning with round 2 by Dr. Basavraj Yamkanmardi.
Good evening, everyone. Myself, Dr. Basavraj. So let's begin with the round 2. So round 2 is basically the identifying the missing link. Basically, it's a flow chart or a diagram from a noun textbook. What you have to do is you have to identify the missing link. So for identification, for correct identification, you will get a 20 marks and the time provided is 30 seconds. So as per the previous rounds, the only one pass is allowed and he will get or she will get 15 seconds and the correct answer will fetch, that is 10 marks. So there is no negative marking and obviously and the quiz master's decision is final and binding. So we shall begin with the round. So this round we will begin with Divya. Okay, so this is an example. So I will be providing one flow chart. So here I have marked one area. This you have to tell what it is. So here it is the masked area is the leakage of cytochrome C. So your answer should be the cytochrome C. Okay. So Dr. Divya, are you ready?
Yes, sir.
Yeah, here is the first question.
Pad.
Yes.
FA.
Yes, correct answer. So this is the correct answer. So the next question to Dr. Surendra.
Yes, sir.
Ready?
Yes, sir.
Yeah, time starts now. Yeah.
Calcium influx, sir.
No.
Reactive oxygen species.
Continue.
Radicals, protein modification, DNA damage. Mitochondrial damage.
No, time is up.
Proteolytic enzyme, sir.
No, time is up. Now it is passed to Dr. Rubashri.
Yes, sir. Lipid peroxidation.
Yes. Rubashri will get the half marks. So answer is lipid peroxidation. Yeah. Now the next question is to Dr. Rubashri. Are you ready?
Yes, sir.
20 seconds more.
Misfolded proteins.
No. It is a response to the misfolded proteins. Time up. Now question passed to Dr. Aishwarya. You have got 15 seconds.
Chaperones.
Yes. The correct answer is increased production of chaperones. You will get half marks. So the next question to Dr. Aishwarya. Are you ready?
Yes, sir.
Yeah, here it is.
Sir, PCAM 1.
Can you be more specific?
PCAM 1 CD31 helps in aids in the diapedesis through the wall.
Yeah. That's a correct answer. So the next question to Dr. Abhishek.
Yes, sir.
Are you ready?
Yes.
Yeah, here it is.
So these are toll-like receptors, TLR.
Yes, the correct answer. Yeah, you're right. So next question to Dr. Shubha.
Yes, sir.
Are you ready?
Yes, sir.
You got 30 seconds. Ten more seconds.
Immune evasion.
Pardon? Repeat again.
Immune evasion.
No. It will pass to Dr. Divya. Yeah, time up. The correct answer is it's a replicative immortality. Okay, so we are done with round 2A. So we shall begin with the round 2B. Okay, that's also a similar round, similar questions. Yeah. So we'll start with Dr. Surendra.
Yes, sir.
Dr. Surendra, are you ready?
Yes, sir.
30 seconds.
EGFR amplification, sir.
No. Try again. Five more seconds. Yeah. Time up. Now question passed to Dr. Rubashri.
Yes, sir. HER2 new amplification.
Yeah, correct answer. You will get half marks. So it's a HER2 new amplification. Okay, there was a clue on the extreme right side of the figure itself. So next question, Dr. Rubashri, are you ready?
Yes, sir.
Yeah, here it is.
MSH2.
No. 10 more seconds. Your time is up. Now, question passed to Dr. Aishwarya.
APC,
No.
EGFR,
5 more seconds.
beta cat,
No. Time up. So the correct answer is P10. Okay, it's a P10 mutation. So next question to Dr. Aishwarya. Are you ready? Dr. Aishwarya, are you ready for the next question?
yes, sir.
Yeah. So basically, this is a isochrome of one chromosome. You have to tell the name of that chromosome.
Isochromosome 9,
10 more seconds.
sir, X,
5 more seconds.
6,
No. The time is up. Now it moves to Dr. Abhishek.
Isochromosome 12.
Yeah, that's a correct answer. You will get 50% of the marks. So next question to Dr. Abhishek.
Yes.
Are you ready?
Yes.
Yeah, here it is.
Activation of CDKN2A.
10 seconds.
Sir, inactivation of beta catenin.
Yeah, time up. Now the question passed to Dr. Shubha.
TP53.
Yes, that's the correct answer. So it's a inactivation of TP53. Okay. So next question, Dr. Shubha, are you ready?
Yes, sir.
Dr. Shubha?
Yes, sir. Yes, sir.
Yeah. So here it is. 30 seconds. Ten more seconds.
CDK for cyclin.
Repeat.
Cyclin D.
No. It is passed to Dr. Divya.
KRAS.
Yes. It's a KRAS mutation. Okay. So next question to Dr. Divya. Here it is.
Oligohydramnios.
Yes, correct answer. So with this, we are completing this round 2B. We will compute the scores and we will get back to you.
Welcome back, everyone. Dr. Basavaraj, thank you for that round 2. Now here we are ready with the scores. So at the end of the round 2, Dr. Abhishek has got 30 marks, Dr. Shubha 20, Dr. Divya PJ after 2 pass marks, she's got 50, Dr. 20 for Rubashri and Dr. 30 for Aishwarya. Dr. Surendra did not get any scores in this. So the total are Dr. Abhishek 70, Dr. Shubha 50, Dr. Divya PJ is leading with 85, Dr. Surendra 25, Dr. Rubashri 40, and Dr. Aishwarya 50. Okay, there are 2 more rounds coming up, so everybody can make up for that. So we now begin round 3 with Dr. Ranjana Ranade.
Good evening, everybody. I'm starting the third round, which is based on crosswords. And this round will begin with Dr. Surendra. So this is a sample, and the round is called as think, ink, link, and lock. So this is a crossword, so there will be something for across and something you need to think for down. And then you complete a crossword. So basically, there will be 3 elements in this crossword. So if you answer one crossword, you will get 10 marks. So if you complete this crossword, you're going to get 30 marks. So for this crossword, initially, there won't be any passing. When you fill these 3 crossword elements, there won't be any passing. If you fail to answer in 60 seconds, okay, then I'll be giving the answer. So the time to complete this crossword, which has 3 elements, will be 60 seconds, and you can take in any order. Okay, you can answer any element. For that, you will be getting 10 marks. And then, so maximum you can score is 30 marks, 10 marks per correct answer, and there won't be any passing. So if you don't answer, you will completely lose 30. But then you will have a chance to take another question based on these 3 elements. Okay, so what is the common link of all 3? That's vegetable. So something like that. United we stand. So how we are together is through vegetables. So you can answer this. If you answer this correctly, this is a master question in this element in 30 seconds. Okay, so you will be getting 20 marks if you answer it correctly. If you fail to answer this master question, this will be passed. Okay, and whoever answer this, they will get 10 marks. So again 50% of this will be given. Any doubts in the rules?
No, madam.
There won't be any negatives, but still I emphasize that please think before you give the first answer. That is considered as the best answer. 1 question per contestant, and there is no sub rounds. 3A, 3B. Quizmaster's decision is final and binding. Shall we start? Dr. Surendra, are you ready?
Yes, madam. We can start.
Yeah. You can take any option from this. Now, then I'll show you the question. What is the question? What do you want to take from this?
Omelette, madam.
Yeah, good. You'll have 60 seconds from now. After 60 seconds, you give the answer. Yeah, time is done. Can you answer some of them?
Madam, the first one is choriocarcinoma.
Okay.
With the liver cirrhosis.
Yeah, now you have to answer. I can't give you more time. First one is choriocarcinoma.
Okay, clue, madam.
No clues. I'll be directly giving you the answer. For that, you will be getting 10.
Okay, madam.
Rest of the 2. Shall I show the answer?
Yes, madam.
Yeah. First one is correct. That's choriocarcinoma. And something worse with liver cirrhosis is hepatoma. Egg yellow and a tumor is yolk sac tumor. For this, you get 10. Now you can try what unites these three. If you think positive, you will find me in all three. In short, that's going to be a molecule. Okay. So our IHC marker, which is common for all these things. So what do you think it is?
Beta HCG. Beta HCG.
Oh, no, wrong. So this question will pass on to Dr. Rubashri.
Alpha fetoprotein.
Alpha fetoprotein.
No, both of you got it wrong. It is glypican. Okay. So GPC3 is the correct answer for this. So we'll go to the next contestant for the next question. That is Dr. Rupashri. Are you ready?
Yes, ma'am.
Yeah. So you can choose except what has been already chosen other than omelette.
Teddy.
Yeah?
Teddy. Okay.
Teddy, yeah. Here is your question and you get 60 seconds. Please answer after 60 seconds. Yeah, your time is done. Can you give some answers? Dr. Rupashri?
Yes, ma'am.
Yeah. 1, 2, 3. If you don't know, I'll show you the answer so that you can take the next question.
Yes, ma'am.
Shall I show you the answer?
Yes.
Yeah. Malignant renal tumor in patients with sickle cell trait. Then that's medullary carcinoma of kidney. Pediatric brain tumor in short in children. Neither teratoma nor rhabdomyosarcoma is ATRT. Not an epithelioid granuloma, but a soft tissue tumor is epithelioid sarcoma. Now, this is lost in all three. Based on IHC, I'm asking you this question. So can you answer this in 30 seconds?
INI 1.
Very good. Excellent. You get 20 for that. It's INI 1. I'm going to the next contestant. That is Dr. Aishwarya. Are you ready?
Yes, ma'am.
Yeah, now you can choose other than omelette and teddy.
Idli.
Yeah. Here goes your question. 60 seconds from now. Yeah, your 60 seconds are done. Can you give the answers now?
Malignant cartilaginous tumor, chondrosarcoma.
Good. Then?
Microvascular proliferation is glioblastoma.
Good. Then?
Forwards AML.
Good. So you get 30 there. So it's chondrosarcoma, glioblastoma, and AML. The second master question goes like this: not mutated in all three. All three. What is it?
TP53.
No. The question passes. No. Yeah. The question. So one best answer is considered here. The question.
IDH mutation.
Very
IDH
good.
mutation.
It's IDH mutation. So the answer is IDH1 and Abhishek gets 10 there. So the question goes to Dr. Abhishek. Are you ready?
Yes, ma'am.
Yeah. Anything which is not selected by others, so now you can select.
Ma'am, the bird.
Bird. So here is your question. Take 60 seconds, complete the crossword. Yeah, your 60 seconds are done. Answers, please. Dr. Abhishek.
Sir, ma'am, the neuroendocrine carcinoma of skin is Merkel cell carcinoma.
Very good.
A bad red fleshy crab.
Okay. Yeah.
Ask him, he knows the name of this. I think this is small round cell tumor, ma'am.
You have to name it. Okay, leave.
Ewings, ma'am, Ewings.
Good. So you get 20 for this. A bad red fleshy crab is angiosarcoma. Okay. So this is angiosarcoma, and here we have Ewing sarcoma. So you can take the master question now. I am in the nucleus of all three.
Nucleus of all three, ma'am.
Yeah.
CD 99.
Okay. The question passes to Dr. Subha.
Ma'am, can I take another guess?
No, no. One best guess. The question passes to Dr. Subha.
Neurosecretory granules?
No. The answer is FLI1. Okay. So that is expressed in the nucleus. That's marker which is expressed in the nucleus of all these tumors. With this, Dr. Abhishek gets 20. Okay. The question now is to Dr. Subha. Are you ready?
Yes, ma'am.
Yeah. Yes.
Suitcase.
This one, right? Briefcase. Take your 60 seconds. Yes, your time is done. Can you answer, please? Dr. Subha.
3 melanoma.
Good. Then?
2 papillary carcinoma.
Yeah, I'm short. Next. First one. I can still give you for papillary carcinoma, but I told you I'm short here. But what is first? Okay, let me show the answer. You'll get 20 for this. So it's hairy cell leukemia, PTC, and melanoma, right? So now you have to answer this. I'm a driver. It's a driver mutation, but mutated.
V600E mutation.
Excellent. BRAF, for that you will be getting 20. So it is BRAF V600E mutation. Okay, good. So you'll be getting 20 plus 20 for this. The last question is to Dr. Divya. Are you ready?
Yes, ma'am.
Yeah, choose something.
I'm left with first aid kit.
This one? Yeah. This is the one, right?
Yes.
60 seconds.
First one is angiomyolipoma.
Very
Second
good.
one, GIST, G-I-S-T.
Yes.
Tigroid testis seminoma.
Very good. You get all 3 correct. So you can take the master question now. I'm activated, mutated in all 3. For this, you get 30 seconds.
Exon, KIT mutation, ma'am.
Yeah.
KIT mutation.
Very good. It's c-KIT mutation. I can give for that. So it's a c-KIT mutation. Very good. Yeah, with that, I complete this round and this was an extra. Okay. Yeah. We'll first wait for the scores and move on to round 4. Thank you.
We'll announce the scores in 30 seconds from now.
Kissed അത്.
Okay, good evening, graduates. We are ready with the scores. After the round 3, the scores are for the round 3. Dr. Abhishek fetched 30 marks, Dr. Shubha 40, Dr. Divya got 50 marks here, and Dr. Surendra 10, Dr. Rubashri 20, and Dr. Aishwarya 30. So at the end of round 3, Dr. Divya is leading with 135 marks. Dr. Abhishek comes next with 100, Dr. Shubha with 90 marks. Then Dr. Aishwarya at 80 and Dr. Surendra at 35 marks. Fine. We'll now move on to round 4. Round 4 will be engaged by Dr. Anita P. Javalagi, professor at SCM Medical College.
A very good evening to all. Round 4 consists of round 4A and 4B. 4A is basically a clinical where the microphotographs will be shared and you have to answer. Basically, it's read the slide, ruminate, and reflect. The rules are 20 marks for each answered question. Identify just one will fetch you 10 marks. Time provided is 45 seconds. Only one pass is allowed and 30 seconds is allotted and one will be getting the second pass on marks is 10 marks. No negative marking and quiz master decision is final. So shall we start with round 4A? And it starts with Dr. Rubashri. Are you ready?
Yes, ma'am.
Okay. There are 2 questions on each slide. You have to answer 2 questions. If you answer one question, half mark is given. Yes. Identify the lesion. Name the gene mutation. Dr. Rubashri. You have 45 seconds.
Okay, ma'am. Medullary carcinoma.
Okay. Second question.
Red.
The time is up.
Medullary carcinoma.
Okay. Do you know the answer for the gene mutation? Can I go to the next Dr. Aishwarya? You have 30 seconds.
Red.
Okay. I'm sorry, Dr. Aishwarya. Dr. Rupashri is answering. So it is the red gene.
Previous round also I had answered, but you had given the chance to the next person. So shouldn't the same be followed in this round?
That's what we gave to the next Aishwarya, right? Rupashri gets half marks and Aishwarya gets half marks. We'll go to Dr. Aishwarya.
Yes, ma'am.
Your time starts now.
Ma'am, Williams tumor,
Second question.
Beckwith-Wiedemann and WAGR syndrome.
Exactly. So you get the complete answer. We'll move to the next person. Dr. Abhishek, are you ready?
Yes, ma'am.
Okay. Time starts now.
Ma'am, this is chordoma.
You can try.
Aneurysmal bone cyst.
Eight seconds. Your time is up. Dr. Shubha. Dr. Shubha, you have 30 seconds.
Okay, ma'am. Giant cell tumor?
No. Time up. The right answer is osteoblastoma and the commonest size are spine, sacrum and long bones. Dr. Shubha, are you ready for the next question?
Yes, ma'am. Chondrosarcoma?
Gene mutation.
Dicer.
Time up. The second question passes on to Dr. Divya.
EXT1 and T2 mutation.
Sorry?
EXT1.
No. You can try. Time up. The answer is IDH1 and 2 mutation. Dr. Divya, are you ready for the next question?
Yes, ma'am.
And Dr. Shubha gets half mark for the question. Dr. Divya, this is for you.
Yes, ma'am. Brunner's tumor.
You can try. Time up. Dr. Surendra, can you answer this question?
Granulosa cell tumor.
No.
Am I right, madam?
No, no. Then try. You have 30 seconds.
Six-cut stromal tumor with annular tubules.
You have another last chance. If you keep on guessing, then
No, madam.
okay. The right answer is carcinoid tumor. These are the immune markers. Next question goes to Dr. Surendra. Are you ready?
Yes, madam.
You have to tell the diagnosis and the special stain.
Special stain is oil red O, madam.
Diagnosis?
Yes, Gorgeous disease, madam. Gorgeous disease.
No. Last 10 seconds.
Niemann-Pick disease.
You can try. Time up. The question goes to Dr. Rubashri.
Pulmonary alveolar proteinosis.
Sorry?
Alveolar proteinosis.
You can try. Last 10 seconds. Timer. The right answer is liquid pneumonia and the special stain. So Dr. Surendra gets half marks. That completes round 4A. We'll move to round 4B. Here, name there is a triad been mentioned. You have to identify the triad, the three features, characteristic hallmarks, and identify the lesion. You have 2 questions and carries 20 marks. If you answer one question, it's a half 10 marks. Same rules apply here. Time provided is 45 seconds. And there is pass on to this. Shall we start with Dr. Abhishek? Are you ready?
Is this? I don't think this is my question first.
Sorry, Dr. Aishwarya. Dr. Aishwarya, are you ready?
Yes, ma'am.
45 seconds. You have to identify the 3 lesions and the syndrome or a triad.
Nevoid basal cell carcinoma.
You can try. You have 30 seconds.
Colin ball syndrome with nevoid basal cell carcinoma.
Fifteen seconds. Yes, the question passes to Dr. Abhishek.
We have to tell you the tumor.
The 3 lesions which have been marked and the triad or a syndrome associated. Triad or a syndrome.
Ma'am, this is von Brunn's nest, cystitis cystica, and cystitis cystica glandularis.
No, no, no. You can try.
This is Brenner tumor, ma'am. Transition cell carcinoma, Brenner tumor.
You have last 10 seconds.
I don't know.
The right answer is it's a breast lesion, columnar lesion, tubercular carcinoma, and lobular carcinoma in situ, and it is Rosen's triad. Dr. Abhishek, are you ready for the next question?
Yes, ma'am.
Identify the lesions and the triad.
Ma'am, this is GIST. This is the Carney's triad, pulmonary hematoma, GIST, and carotid body tumor.
Excellent. You get complete marks. Next question to Dr. Shubha. Are you ready?
Yes, ma'am.
You have 20 seconds.
Bronchopulmonary dysplasia.
Time up. The question goes to Dr. Divya.
Cystic fibrosis.
Identify the 3 lesions and a triad.
Pulmonary artery thrombus.
Time up. The right answer is bronchiectasis, recurrent sinusitis, and situs inversus. It is Gardner syndrome or a triad. Dr. Divya, are you ready for the next question?
Yes, ma'am. Cholecystitis, appendicitis, and
Sorry? First one, what did you say?
cholecystitis, appendicitis, intestinal.
To get half marks, you have to identify all 3 lesions. You have last 10 seconds. The question passes to Dr. Surendra, who has to answer the triad. Only triad because she has answered 2 components. Third component you identify and you have to answer the triad. Last 10 seconds. The answer is chronic peptic ulcer, chronic appendicitis, and chronic cholecystitis, which is Wilkes syndrome. Dr. Surendra, are you ready for the next question?
Yes, madam. Hemolytic uremic syndrome, madam.
Identify the components.
Anemia, oliguria with purpuric rash.
Purpuric rash is due to?
Thrombocytopenia.
Excellent. Dr. Rubashri, are you ready for the question?
Yes, ma'am. Infective endocarditis, heart. This is Streptococcus loba pneumonia. Cerebral abscess. Infective endocarditis.
You had 20 seconds. You have to identify 3 components. You have identified 2. To get half marks, you have to identify all 3 correctly. The question passes to Dr. Aishwarya. Can you name the syndrome or a triad?
Endocarditis, pneumonitis, and meningitis Oslo's triad.
Excellent. but you get half marks as it was a pass-on. This completes round 4A and 4B. We'll get back to you with the scores. Thank you.
That was some excellent quizzing. We'll come back to you with this course in just under a minute. Okay, yes, we have done come with round 4 now. Only round remaining is the rapid fire. And we'll now have the scores for till round 4. Okay, at the end of round 2, Abhishek fetched 20 marks, Shubha 10, Surendra 30, Rubashri 10, and Aishwarya got the highest with 40 marks in round 4. So at the end of round 4, the leader is Dr. Divya PJ. Even without scoring anything in round 4, she's still reading at 135. And the second is tied between Dr. Abhishek and Dr. Aishwarya. Subha is close at 100. And Dr. Surendra and Dr. Rubeshri have to some catching up to do with 65 and 70 marks respectively. But PG is nothing to worry. The last round is a rapid fire round with each question having each set having 10 questions and 10 marks each. So you can score 100 marks potential in the last round itself, and anybody can take home as a winner from this last round. So are you all ready for the last and the final round? That is the rapid fire round. Okay. So as I told you, anybody can make up for the lost time here. We'll have some fun with it. In the rapid fire round, we have a different segments called the Path Design, Path Chrome, Path Flip, Path Cuisine, Path Safari, Path Tags, Path Shine, and Path Tree. So we wanted to randomize it, and each set will have 10 questions. So the rules are each, you'll get 1 minute to answer it. You can get as many questions as you want from it, but the time limit is fixed, 1 minute. At the end of 1 minute, we'll stop asking questions. Every correct answer will fetch you 10 marks. There are no negative marks. Passing to the next candidate is not allowed. Theme is automatically chosen based on the spin wheel. So it's random and it's luck based. So please say pass if you don't know the answer and move to the next question, because the target here is to get as many questions as possible and get as many right as possible. That can completely change the equation of who's the winner and who doesn't get to take home the prize tonight. So, but before I do that, I want to warn you that only the first answer will be considered. Just so that when the moment you utter something, that will be the final answer that will be considered. You can't change the answer after that. You got all 6 candidates? Are you ready? Okay. So we will now do a wrap. Okay. Okay, here is the spin wheel, and all 8 options are already punched in, and we will spin the wheel. And we'll start this round with Abhishek. Abhishek?
Yes, sir.
You will go first. We'll spin the wheel. We'll see what you get, and then we'll start the questions based on that. Okay. So you got path cuisine, okay?
Yes.
We will ask you questions based on that topic now.
Right.
Dr. Abhishek, you chose path cuisine. You have to identify the food item, but you have to tell me the tumor. Okay?
Right.
You have to look at the picture and name the tumor where that is seen. Okay, shall we start? You have 10 questions, 1 minute.
I have to look at the picture and tell you the tumor, ma'am.
Exactly. Okay. Shall I start? You
Yes.
got 1 minute and 10 questions. Here we go. Name the tumor.
Ma'am, granulosa cell tumor, ma'am.
No. Name the tumor.
Hodgkin's lymphoma, popcorn cells, ma'am.
Name the tumor.
Ma'am, oligodendroglioma.
Yes.
This is ma'am oat cell carcinoma. Coffee bean nuclear granular cell, coffee bean nuclear granular cell tumor, ma'am. Donut cells, anaplastic large cell lymphoma,
Yes.
which has donut cells. Carrot, pilocytic astrocytoma, ma'am, or neurofibroma, which has carrot-shaped cells, collagen fibers.
Next.
This is an oat cell carcinoma.
No. Next.
No, next one, ma'am.
Time up. Okay.
The question, you've taken all the 10 questions, Dr. Abhishek. So that ends your round. We'll be sharing the scores at the end of the round. Next is Dr. Subha, right?
Yes, sir. Yes, sir.
Subha, are you ready?
Yes, sir.
Okay. Here we spin your wheel. Let's see what you get. Okay, you get patch shine. Subha. So in this round, Dr. Shubha, you will have to identify this is patch shine. Here we'll show you some cast crystals and shining objects under the microscope. Then you'll have to identify them and name them. Okay? Dr. Shubha, are you ready? Shubha?
Yes, sir. Yes, sir.
Your time starts now. Your first answer will be considered, okay?
Okay.
First, say pass if you don't know.
Pass, sir. Congruent apple green by reference.
Yes. Next.
Next. Thorn apple appearance.
Wrong. Next.
Envelope shaped crystals.
Name the crystals.
Calcium oxalate. Staircase cholesterol crystals. Cysteine.
Wrong.
Leucine, sir. Tyrosine. Tyrosine crystals. Pass, sir. Next, sir. Ammonium phosphate.
Your time is up. Okay. Done. Okay. Next is Dr. Divya.
Yes, sir.
Divya, are you ready for your wheel? Let's see what you
Yes,
get.
sir.
Okay, let's spin your wheel. Okay, you get tag. Divya, you get tag, and here it is.
You just have to answer all the IHC markers, okay? Yeah. Are you ready?
Yes, ma'am. But I can't see the screen yet.
Wait a second. Are you able to see now?
Not yet, sir. I can. Yes, sir. I can see.
Yeah. Shall we start? Dr. Divya, are you ready?
Yes, ma'am.
Your time starts now. Highly sensitive and specific marker for solitary fibrous tumor. Say
S100. S100.
highly sensitive and specific marker for synovial sarcoma. Say pass if you don't know. IHC marker of phosphaturic mesenchymal tumor. Highly specific marker of poorly differentiated chordoma. Most sensitive and specific marker of pre-B cell.
TDT.
An IHC marker to differentiate complete mole from partial mole.
An
IHC marker to detect endothelial cells of lymphatics.
CD30.
Commonly used IHC marker to diagnose humoral rejection in transplant. That's the last question. Yeah, your time is out. Yeah.
Okay, we are done with Dr. Divya. Next is Dr. Surendra. Dr. Surendra, are you ready for the?
Yes, sir.
Yeah, let's see what the wheel has in store for you. Let's spin it. Okay, you got path chrome.
Yes.
Basically, in path chrome, you'll have to identify all the special stains that we are going to show you now. Okay, we're going to project the image, identify the stain. Okay.
Okay.
Are you ready? So, path chrome. Are you able to see the screen?
Yes, sir. I can.
Okay. Your time starts now.
Alcian blue, sir.
Next.
Mason's trichrome. Sorry, this is Mason's trichrome stain.
Next.
Van Giesen.
Next.
Amyloid. Congo red.
Say pass or answer.
Pass. Pulse Prussian blue. Reticulin. Van Cosa fibers. Van Cosa. This is a GMS.
Yeah, that ends your thing. Your time is also up. Okay, so the next question, so next rapid fire is for Dr. Rupashri. Rupashri?
Yes, sir.
Yeah, okay. Let's spin the wheel then. 4 more options remaining. Okay, you get Path Safari. Yeah.
Can you see the screen?
Yes, ma'am.
This is for Dr. Rupashri, right?
Yes, ma'am.
You have to just name the, different cities which are related to the particular question. Okay. So that's the theme here. Shall we start?
Yes, ma'am.
Yeah. Your first question and time starts now. Urine cytology reporting is named after which city?
Paris.
Red cell inclusion in Babesia is named after which country?
Pass.
Truncated chromosome 22 due to reciprocal translocation is named after which city?
Pass.
A disease due to point mutation of factor V gene is named after which city?
Leiden.
City of origin of Ki67.
Pass.
One of the common patterns of tumor cell arrangement in lobular carcinoma is named after which country?
India.
Salivary gland cytology is named after which city?
Milan.
A hereditary inflammatory disorder with pyrin gene mutation is named after which region of the world?
Pass.
Causative organism dracunculiasis is linked to which place?
Pass.
Thyroid cytology is named after which city?
Bethesda.
Done. So your 10 questions and you're done.
Okay, thank you, Dr. Rubashri. Now we are moving to final rapid fire with Dr. Aishwarya. Aishwarya, are you ready? Yes. Let's spin the wheel. You still have 3 options to choose from. Okay, here it goes. You get path design. This will be the final one. Let's see if you can make it here.
Dr. Aishwarya, are you ready?
Yes, ma'am.
So path design is nothing but the pattern of arrangement. You have to identify the pick and identify the pattern, but you have to name the tumor in which that pattern is seen. Okay? Answering the tumor will give you the mark. Shall we start, Dr. Aishwarya?
Yes, ma'am.
You have to name the lesion in which this pattern is seen. Here we go. If you don't know, you can say pass.
Pass. Pass, ma'am. Ma'am, rosettes seen in retinoblastoma, medulloblastoma.
Yes.
Pass, ma'am. Picket fence up. Next, ma'am. Next. Cribriform pattern, adenoid cystic carcinoma.
Yes. Next.
Patternless pattern SFT.
No. Next.
Ma'am, whirling seen in meningioma.
Yes.
Multiple psammoma bodies seen in papillary carcinomas.
Time up. Yes. Here ends your round.
So, all right, we have now completed quizzing for all 6 postgraduates. We will have this course very soon. Meanwhile, Kim, Wi-Fi ma'am, would you like to address our postgraduates till we get ready with the finals course? Ma'am, you're not audible. Kindly unmute, please.
Sorry, so sorry.
Yeah, ma'am.
I think we have to ask them the experience. How do they feel about? Because I feel that it's really been conducted so well. It's really high tech, and I think a lot of input has gone from your sides. All the quiz masters, I think, have spent a lot of times, and it is really remarkable. I think we would like to give you all some kind of certificates for your contributions from IAPM. I think we should do that. We must do it for the quiz masters. But for the candidates, possibly, I think it should come from your side, huh, Aditya? That's fine.
We will, so with Kim Wi-Fi ma'am's orders, we will be issuing certificates to all participants for the round 1, round 2, and round 3. All of them will get participation certificates.
Yeah, I think that's to encourage them, right? And though they could not make for the final round, just to encourage them, I appreciate their contributions, because without their contributions, I think without their taking part, I think it would have never been a success. It is a grand success. And now I think I'd like to ask all 6 of you, what are your experiences? What do you feel about? Where it could be improved, or it was perfect and good, conducted very well? Any suggestions, any opinions? Anybody, speak up.
Good
I
Good
was
evening, madam.
brilliantly
I'm
conducted,
Dr.
madam.
Surendra from Stanley Medical College.
Yeah.
Agnihotri sir was excellent, madam. The quiz was quite clear and excellent. It was there was no confusions during the rounds, madam.
Yeah,
It
that's
was
I
conducted
agree. I agree
excellently.
to
Thank
that.
you, thank you, thank you, sir. He was
Anybody else?
he was
Yeah.
there for the past 10 days, madam.
Good.
Thank you, sir.
Anybody else? Speak up. Sarita, you want to say anything? Yeah, your voice is not very audible. You know, you're sitting right behind.
We learned a lot, and there is a lot ahead to learn.
Yeah. Anybody? I was really appreciating the way you all come up so fast, you know. I think really bright brains. Very good. Anybody else? Anything you all want to add or say anything about?
It was amazing, ma'am. It was brilliantly conducted.
Aishwarya, please go ahead.
It was really conducted and the instructions were very clear before and during the quiz. So there was no mishaps and every quiz master were very encouraging about answering. So very nice experience overall.
Yeah. Dr. Asranti, I think you were there or you heard me because I think we should acknowledge all the quiz masters. We should get them some
Yeah, madam. I
certificate from
also
our
heard
side.
they have really conducted
Yeah, I
it
think
very well.
we should do that. I think they have put in a
Yes.
lot of time and efforts.
Yes,
It's not
madam.
easy to have this standard of quizzing. It's really fantastic.
Yes,
That's why I
madam.
was asking Dr. Aditya whether he has done any management course or not. I don't believe you when you told me you have not done it. I'm sure you have done it.
Thank you. Thanks for
The way you are managing. It's
I
fantastic.
think, madam, they
But
have
just to
set up an example. I think it's exemplary. The way they conducted the quiz. It's
We
really an
should learn
example for
from
all the whole
them.
country.
Yeah, we
Yes.
should learn from them, Dr. Asranti, how they
Yes.
conduct themselves.
Yes,
It's
yes,
something to
They have
learn.
done.
Yeah,
Yes.
we should learn something from them. Yeah.
Thank you, ma'am.
I think that's enough, isn't it?
Yes, ma'am. We are done with the scoring.
Dr. Aditya, I really want to congratulate that KCIAPM has taken this challenge and they have really done it in a very excellent way. Though
Thank
we
you.
are thinking since 2017 that for National Pathology Day, I remember Dr. Vijay Shankar will remember. But
Yes,
finally, better late than never. And then what you are doing as an activity is remarkable. I really congratulate all of you.
Thank
Entire
you.
KCIAPM.
Thank you. No, now we will.
Like to
Yes,
congratulate
ma'am.
you and your team. Very well done. It was really very enjoying, and all the questions, how meticulously they were planned, and a great artwork we can see has been done behind conducting this quiz. Once again, congratulations from to whole of team, all the members who have helped you in conducting this quiz. Very nice. Very
Thanks a
well
lot, ma'am. Means a lot. But on
Aditya,
behalf
we do have some more senior people, Dr. Lanjivar, Dr. Harsmohan, Dr.
Harsmohan, sir,
Dattagupta,
any
Dr.
words?
Mahanti. And you would like to say something? Dr. Lanjivar, sir, you want to add something, anything? Are you there? But we can see your name. Dr. Harsmohan, I've been seeing you actually. You were there sitting for quite some time. Dr. Dattagupta and Dr. Mahanti.
Yes,
Sir, you
I
want to
think
say anything?
it's
Please say.
wonderful.
I'm
Yes,
Dr.
ma'am.
Mahante speaking. So
Okay.
it's quite a new thing for me. And I find the Karnataka chapter is taking a lead and showing a new way to how to conduct this thing. And especially I am just from the beginning till end. And I was very much
Yes, sir.
enjoying the quiz. I am now in 80s. So I just remember this
I learned so
morphology
many
and
things.
other
I learned so many things.
I am very glad, and I expect similar things in future, and which will interest like us, people like us. I am the senior most person is here. I enjoy it is very much. I
You
thank
may be the
Karnataka
senior
chapter.
most and the oldest. Yeah. Baki, I think Dr. Lanjiva, Dr. Dattagupta, Dr. Harsmohan, Dr. Usakini also I can see. Yeah, please say something to encourage the students and also the quiz masters. Fantastic work. Such a discipline. Needs to learn. I think we need to learn from them how to discipline
I think,
ourselves.
ma'am, it's congratulations to IAPM and to especially to KCIAPM for conducting this National Day in such a memorable and wonderful manner. Both the speakers, Dr. Sanjay Pai, as usual, is really enchanting in all his talks, and your speech also was really wonderful. From the
Thank you.
microscope to
Thank
morphology.
you. That's very kind of you. Thank you very much.
And the quiz, I think, is the icing on the cake. They have worked very hard to get all these things. It was not extremely difficult, not very easy. So I think getting the
definitely.
balance is the best part of a quiz and most difficult, and that's how a good quiz is. And the students were remarkable, man. I'm so happy that the 6 of them, all of them did well. But sometimes, some questions here, there makes a difference. So I guess there'll be difference in the marks. We'll wait for the final. But all in all, it was a wonderful evening and a worthy National Day. Pathology Day. Thank you.
Thank you, sir. Lanjiva sir is here. Lanjiva sir.
I just want to congratulate to all of you.
Yeah.
You have done a great job.
Yes.
And when I heard Dr. Sanjay Pai and listening a story of Dr. V.R. Khanolkar, it was all nostalgia to us because he started his career at Grand Medical College, Mumbai in 1924. And in the Grand Medical College and Mumbai, we heard a lot of stories about him. And Sanjay Pai has very well narrated. One thing about quiz I want to inform you that last rapid fire, that I did not like because it is a one theme. It should have been mixed theme together for all participants. Because it was very difficult. Only one theme, color and then stains and architecture. It should have been given to everyone. Possibly that would have been better. So for next time,
Keep that in mind, sir.
Change that pattern, yeah. Then everybody gets the same opportunity. Here, opportunity was not same to everyone.
Dr. Varsha Dume has her hand, sir. Ma'am.
Yeah. Dr. Aditya, first of all, congratulations to all of you. Excellent organization of the quiz. Excellent. And congratulations to all the participants, whosoever even reached that last 30s. Excellent. I just want, Dr. Phatak is here with me on the same line and she would like to say something. Dr. Phatak, past president IAPM, please. Here she goes.
Congratulations to the entire team and congratulations to the participant first of all. This was the first National Pathology Day celebrated, and my kudos to all of you. I just wanted to say that little bit time can be increased to observe the things, and otherwise the way it was conducted, it was superb, and entirely credit goes to the all who had taken all efforts to conduct this. Congratulations to Dr. Kim and congratulations to Dr. Aditya. Okay.
Thank you.
Excellent.
I think, yeah.
Everybody
Dr.
should.
Pai, sorry. Dr. Pai, you would like to say something?
Oh, I just like to say the quiz was very good, and Aditya keeps improving his standard, raising the bar for himself every time. I don't know how he does it. I quite enjoyed myself.
Yes, work very hard. Yes.
And I don't think I would have been able to answer most of the questions. I must be honest about that. But I'm not taking for any exam now, so it's okay. And thank you, Siddharth and everybody else. And thanks for inviting me.
Thank you, sir. We were very happy to have you here. Dr. Ushakini, ma'am.
Dr.
Ashmon sir is
Ushakini.
saying something. Ashmon, sir. Okay.
Possibly, I think they are not there. I think they are not there.
Okay. Now, okay, I think there's no quizzing without the participants. We were very happy and we were glad to have so many participants from across the country representing these quizzing. That we had 230 participants from more than almost all states were represented in this, and even the top 30 had representation from 15 states. So that they were the cream of the cream. We had to choose, we had to struggle to choose the top 6, and we had to eliminate so many people. That was difficult, but we have finally got the top 6, and all top 6 for us are winners. On behalf of the scoring team and the team at KCIAPM, myself, Dr. Aditya, Dr. Anita, Dr. Anjana, Dr. Basavraj, and our scorers, Dr. Milana and Dr. Sonali, we are very happy to conduct this quiz, and we feel that all top 6 are winners. But for the sake of prizes, just for the sake of prizes, we have to announce the top 3. And ma'am, shall we make the announcement?
Yeah, please do. Go ahead.
Yeah. The third prize goes to Dr. Divya PJ from JJM Medical College, Davangere.
Congratulations. Yeah.
A round of applause for you.
You also give her a clap.
Our scores were 135 at the end of round 5. Dr. Divya, congratulations.
Thank you, sir.
Would you like to say something?
It was nice, sir. I enjoyed. I learned a lot.
Yeah, you learned a lot. That's important.
That is important. Yeah.
There's always the next time. Next time you can get first. The second prize goes to Dr. Aishwarya.
Oh yeah, great. Yeah,
Congratulations, Dr. Aishwarya. You scored 160 marks.
Great, great, great. Yeah.
Aishwarya, you would like to say something?
Sir, it was overall a very nice learning experience, preparing for the quiz and attending the quiz, the different questions, patterns. It was an opportunity.
Congratulations. The third prize gets 4,000 rupees. The second prize gets 6,000 rupees. And the first prize gets 10,000 rupees. And any guesses for who is the winner for the National Pathology Day 2022? First ever National Pathology Day 2022. Winner of the first prize, 10,000 rupees cash is? Any guesses? It is Dr. Abhishek Singh from Hospital, Bangalore.
Congratulations.
Congratulations, Abhishek.
Congratulations.
Dr. Abhishek scored 170 marks at the end of round 5. We'll now be happy to share this course, just to be fair to all the PGs.
Yes, yes.
Dr. Abhishek scored 170, Dr. Aishwarya scored 160,
Oh,
Dr.
yeah,
Divya got stuck at 135.
Great,
Dr.
yeah.
Shubha was very close at 130. Dr. Rubashri got 120 and Dr. Surendra got 85. But for all of us here at KCIAPM, all top 6 of you are winners, okay? Dr. Abhishek, would you like to say something? Congratulations, first of all.
Thank you so much, sir. It was a wonderful experience. I have been quizzing since my school days, but I was more into sports and entertainment. But I took pathology now. This is a new experience to go into pathology. And I must say, sir, it was brilliantly conducted. It was extremely professional. And there were generally in quizzes, you have a lot of controversies, people fighting amongst each other, but there were absolutely none. And there was no scope for any controversy. And thank you so much, sir. It was a wonderful, wonderful experience.
Abhishek, I just want to ask you something.
Yes, sir.
You appear to be very active in sports and many other things. So are you planning to stay on as a pathologist, or you're going to look something greener?
Ma'am, I am basically from AFMC Pune, and
Oh, yeah. Yes.
now I'm doing my PMD, and I have no choice but to continue, ma'am, because I am in the armed forces, so I have to continue.
Okay.
Yes,
Okay. All the best.
Thank you.
So with that, we conclude this quizzing, and with the winners, the other 3, Dr. Surendra, Dr. Rupashri, and Dr. Shubha. Congratulations. I think for us, you are also winners. Okay. I hope, and you did a great job today. Ma'am, with that, we can conclude the...
Yeah, definitely, please.
Dr. Varsha, please. Dr. Patak, ma'am.
Yeah. Are there no, not Fatak madam, it's me. I'm asking, are there no consolation prizes?
Ma'am, you are the treasurer, you have the money. If you're ready to, ma'am, if you're ready to spare some money, we would be happy to give the prizes away.
Ranjan sir is very much there, and Ranjan sir, we do have consolation, I think, no?
Ranjan sir is not audible. You would be happy to give away consolation to all the remaining 3.
Posted, Let me check with the new bylaws. If the new bylaws are already in force, then you have the consolation prizes too.
Yes. Amazing. So, Surendra, Dr. Surendra, Dr. Shubha, and Dr. Rupashri, we have Dr. Varsha has some good news for you.
Wrong, 2 consolation prizes. But
Okay.
then now I don't think we should leave Surendra behind, right? Surendra behind.
Yes, yes. But all
let's
top 6 are winners, ma'am.
see what
So,
provision. I will discuss with Kim ma'am and the other team members what to do about this, but we will have. Everybody will get something or other. Let's see. And
That's great.
make sure that every 30 participants or whatever you decide, 200, 230, get the certificate of participation,
get the certificate.
whether they have cleared first.
They will get the participation certificate. So there's something to cheer about for Dr. Surendra, Dr. Rupashri, and Dr. Shubha.
Yeah, yes, for encourage. Yeah, encouragement. It will be not great as per amount wise. It may not be as great as what Abhishek will get, but he will definitely have something.
It's never about the amount anyway.
Yeah, I just
for that.
things with madam.